suction the patient in Q4 hours and PRN, and perform trach care Q8 hours in PRN, and it is time to do both. So I'm going to
Valerie Jones, Oregon 981, known on allergies.
Hi, my name is Brooklyn.
Section every 4 hours to perform trach care.
Good night. She says her arm breaks.
Wash my hands.
Provide
Hello, my name's
proxy.
Mackenzie.
Wash my hands.
The physician has ordered trach care and suctioning.
I'm going to
Check my order
if she has any
and
allergies.
make sure that my
I'm
oxygen,
going to hyperoxygenate the patient.
delivering
with
oxygen at
suction.
the appropriate amount that my doctor wants. I'm going to
And then I'm going to make
hyperoxygenate.
sure my saline is not expired.
Well,
And I would
before I do
definitely
that, I'm
if
going
it wasn't.
to verify again.
Okay.
Valerie Jones, 11981. Then I would administer the oxygen.
And then I'm going to
So
open
that's
it
fine.
sterilely.
I'm going to open up my.
I'm just going to open it up. Right, and I'm going to grab.
I'm going to pour saline in here. I'm going to make sure that it's unopened. If it was, I would check for the time and date of that. And if it's never been opened, if I'm opening this, I'm going to time and date.
Alright,
That
and I'm
and
going to pour my saline into it.
So
And then I've already washed my hands.
pour some
So
in
I'm
there.
going to go ahead and apply my sterile gloves.
Before I get that, I'm going to lay this down so I don't lose a sterile hand. I'm going to wash my hands. Okay.
These gloves come a little wonky in this case.
Gonna make do.
Alright. Those gloves come really wonky. Okay. So now I'm going to grab my suction.
Making sure that I do not break sterility. Alright, so now I'm going to get my sterile tube out of here.
Wrap it around my hand.
So I'm going to wrap this with my hand,
So I'm going to take this section.
and with this hand, I'm going to
And I'm going to
connect my
it and
section.
keeping it sterile.
So I officially washed a sterile hand. So now I'm going to,
Alright, so it's
my patient is hyperoxygenated. I'm going to dip in the water.
and this hand is no longer
I'm going
sterile.
to, without touching it,
Yeah, it's not letting it stay up there. So
insert until I meet resistance.
dip that
And once
into
I
the
do,
saline.
I would pull back an inch. And I would
without touching
circular motion,
I'm
do
going to
intermittent suctioning for 10 seconds, and then I would pull out.
And
Then I
pull
would
back for 1 inch.
Dip in my
And then
water
apply
again.
intermittent suction for 10
Then
seconds.
I
I'm
would
pressing my thumb, and I am
Insert again.
making sure that I'm not touching the
Circular,
trace.
intermittent fasting, or intermittent suctioning, and then I would pull out. And if the patient needed it, then I would do it a third time. If the patient is good.
That's how you control the suction. You have to keep your hand on the
I thought you press your thumb.
Yeah, you have. Yeah.
I'm going to coil this
Yeah, you
up,
have to keep your hand
and
on
unhook
the
this,
thumb to actually.
and I'm going to throw this away.
This layer we got else to set up.
Okay?
Put those gloves on. I did too.
You did really good.
I was like, oh.
So before I do that, I'm going to make sure that I continue to hyperoxygenate my patient. Now I'm going to open my next kit. With this, if I were done with that and I had to leave the room, I would turn down my oxygen, but I'm going to stay in here and do it all at once. So I'm going to leave it up and make sure they're hyperoxygenated. So that is good. And I'm going to open my kit.
Yeah.
I don't need this anymore, so I'm gonna put this over here. So I'm going to pour saline in here, making sure that I don't break the scalp out of the pot. So then
Really?
I would do that, and I'm gonna put gloves on,
Can I just say, just get this?
and I'm gonna remove.
Okay. Okay. We can clean this again.
So I would take it out and put it in to be clean. So that's cleaning. So now I can take that off. And with this, I'm going to take off the gauze and assess the gauze for any drainage or redness or anything like that. So with that, I'm going to throw that away. Now I'm going to perform the hair. I'm going to make sure I wash my hands. Take my gloves out.
Okay. Got my order, my supplies. I'm gonna check my order, make sure it's verified by my physician, or by the patient's physician. Look at the name, diagnosis, date of birth, allergies, and we've got an order for suction and trache care.
Okay.
So,
Just gonna go with it.
I'm gonna get over the supplies, come to the patient's room. Hi, my name's Brooklyn, I'm gonna be your nurse today. Can you tell me the name of her? And match her all this, that's what she says to the order. I'm gonna perform trache care and suctioning, and I'll just explain the procedure to the patient.
Okay.
Wash my hands, provide for privacy, and rinse the bed. Michelle, do you have any allergies?
Just broke this, so I would have them get me another pair.
Expiration date on my phone, make sure it's not expired, and I would label it if it wasn't labeled.
And any good nurse would have 2 sets of gloves with them.
So, I've
So,
already checked this, so I'm gonna set it
I'm
out
going
of the way.
to wash my hands again.
I'm gonna hydroxygenate the patient and check the suction. So I will turn this up. And make sure that the patient's head is closed, or the neck is closed. And then I'm going to open this sterilely.
Okay. So that's on. Now I can situate my gloves. Okay.
Okay, so I'm gonna grab,
Okay. Now I'm going to drape over the patient.
no, well, that's okay, I'm just worried. It's supposed to be like that.
Okay.
Well, the box is on top of it, so it's gonna be breaking strong.
Okay. So now that I have that set up,
I'm just like, that doesn't look right.
I am going to get Yep.
Okay.
Alright. So now I'm gonna set up my
Because I'd rather not come back and do this again. Okay. Order.
Okay. So now that I have everything set up, I will take it and dip and clean inner to outer, and then toss. Which I'm
I'm gonna check my order and have
Dip.
an order for Valerie
And
Jones.
clean
I'm gonna
inner
put
to
down
outer
nurses, physician,
and
favorites,
toss.
and allergies.
So I would
And it's
repeat that 4
verified,
times.
And we have an order to
Then
suction
I'm
and
going
trache
to
care. So I'm
take
going to
my
my name is Brooklyn, I'm gonna be your nurse today. Can you tell me your name and date of birth? Tell me Valerie Jones.
and I'm going to
So I'm gonna explain the procedure, provide for privacy, and wash my hands.
clean it. I'm gonna take my tubing and clean it. And I'm gonna
hyperoxygenate the patient and check
Clean
the
this
suction.
way,
Make sure that
and
the
then I'm
vaginal
going
sac
to
is
clean
and
this way,
ready.
making
Wash
sure
my
that I
hands
get
and then
both
check.
ends.
Make sure my saline
Um,
is expired and label it if it was not already labeled. So I'm gonna
And then I would
set
toss
this
it.
away. And I'm gonna get
Then
suction stick,
I would
and I'm going to open it
dry it
slowly.
from the inner outer.
I'm gonna grab I'm going to open it,
Cleaning it,
and then I would lip seal
Then
the
I
saline
would
and then pour it in there.
take it and dry it on the outside
And then I'm gonna put my sterile gloves on.
and toss. So now I would insert my tubing, and then I would get my hemostats,
Okay. So I'm going
Grabbing-
to grab.
making sure that I do not touch the inner part, and then I would
Alright, so I'll have to fix that once I get this. Okay. So now I'm gonna sterile this up. First I'm gonna grab the suction.
Okay, so now that that is up around the patient, then I would, my hands are obviously not sterile anymore, so I'm going to change my neck cuff.
So I'm going to wrap this on and I'm going to hook it to the suction. So this one is no longer sterile. And then I'm going to dip this into the saline, and then
I would do
pull this down. And without touching the
So I'm only gonna like loosen it before I completely,
I'm going to go until I'm
undo
resistant,
everything.
and pull back 1 inch. And
that
then I'm
way
gonna do
in
this for
case
10
something
seconds
goes
before rolling
wrong,
and applying
then
and suction.
I still have
So I'm using my thumb
the
to
tie
do
on the
suction.
patient.
Alright, and then I will pull it out. And I would repeat this step 2 to 3 times depending on how much the patient needed it. So I would dip in saline and then repeat the same steps. So then that is done. So I'm going to pull this up. And I'm going to disconnect. And we'll put that back.
Okay. Now then I would make sure that it was completely secured, and I would take off the old tie.
And discard into a biohazard bag.
Then I would give the patient oxygen if they needed it.
And I would,
And then I would turn it down.
I would make sure if I
I
was
would
leaving
take
the
my
patient's
gloves
room,
off.
I would make sure to turn the oxygen back down, but I'm gonna stay in the patient's room, so it's okay.
Make sure the patient didn't
So,
need anything.
Now I'm
And
going
then
to
I would make sure that the pillow was lowered back to a comfortable position from where we did Trache care.
Let me get all my
I would lower the bed, make sure my oxygen is turned down, wash my hands, clean up my mess, and document.
Alright, and then